community, and I do clinical research.
My name is Marcella, Alsan. I'm an assistant professor at CHP Corps, and I have a background in both medicine and economics.
I'm Javarsi. I'm a sophomore here at Stanford. I'm most likely majoring in biology, but currently expecting to go to med school.
We started a pilot study, which is examining some of the factors that get Black men in particular to seek preventative health care.
This notion that trust is important, trust in institutions is very important, I think that's very relevant, and it takes a long time to build it back up.
And one of the big factors are historical abuses. And the most well-known and probably the most egregious historical abuse is the U.S. Public Health Service study of syphilis around Tuskegee, Alabama.
And what had happened was for 4 decades, from 1932 to 1972, they specifically targeted Black men in the South who had very little education and followed them even though they had a treatment for syphilis and watched them as the disease progressed.
One of the big things I remember always being emphasized growing up is the huge gap in life expectancies between African American populations and Caucasian populations, specifically between white and Black men.
It had been written about for a long time that might have actually had an effect on the trust that particularly those men had in the institutions of public health, in medicine. We just took that hypothesis seriously, and we dug around, myself and my co-author, Marianne Wanamaker from the University of Tennessee, to actually see if that hypothesis held water. And we found that it did.
So those are some of the things we're trying to determine. What are the real factors behind African American male mistrust or distrust of the healthcare system? So we first started working in barbershops, and we went to barbershops to recruit Black men. If you know anything about the Black barbershop, everyone, if you need to get your hair cut and you're a Black guy, whether you're rich or poor, or PhD, or didn't finish high school, you go to the same barbershop that is part of your community.
I think as the Black barbershop, we're somewhat looked to as a pillar of the community. So we take on the responsibility of helping the Black man's well-being.
I would definitely say I love my experience in a barbershop. I think one thing that I really got a feel for is like the many facets of the communities, especially specifically the even African American male communities within Oakland.
One thing we learned was just how much weight the Stanford brand has, and how I think happy people were that we were interested and involved with their struggles.
We have limited access to healthcare opportunities.
We would really leave this kind of bubble that we're in and really go down and see some of the challenges people were facing financially, economically, socially.
Me personally, I've had bad experiences with the medical system, with the criminal justice system. So a few years ago I was shot, and I wasn't necessarily treated the way that I would have liked, right? And one thing that I noticed and one thing that I didn't see is people that look like me, and which instantly put me in a state of vulnerability.
Because a lot of minorities, they don't seek health care for many reasons, whether they're scared or they just don't know. But with me being in the face of the shops, recruiting is kind of like, oh hey, this guy, it's just kind of like, it's a connection.
This is a bigger problem than just in my community, because throughout this research project, we were able to meet folks from Africa, we were able to meet folks from different states, and it's a common problem throughout this nation, right, throughout the world.
So Dr. Alsan and I hope to uncover a few things. One, what are some of the factors that either get Black men to seek preventative health care, or to prevent them from seeking preventative health care? So if we know that, if we look at the positive side, we can maybe impact policy or work with institutions like a Stanford or a Sutter Health to design systems that reinforce some of those positive aspects.